The mumps. The scientific name of the mumps is the mumps virus, but it is also called parotitis. What is the mumps? The mumps are an infectious disease caused by a virus, which causes swelling in the parotid salivary glands. What causes the mumps? The mumps is a disease that is caused by a virus that spreads through saliva from someone that already has the virus. Once you've contracted the virus, it travels from the respiratory tract to the salivary glands, where it reproduces, which causes the swelling in the glands. The mumps can be spread through sneezing and coughing, using the same silverware as someone who has been infected, or drinking or eating after someone who has been infected. First recorded case. Medical historians believe that the mumps date back to the Greco-Roman times. The first effective vaccine for mumps was brought in 1948 and was used from 1950 to 1978. This vaccine did not have a long-lasting immunity on the virus. Now, in the U.S., we have an immunity rate of 80%. Signs and symptoms. Symptoms usually appear 2 to 3 weeks after the infection. Most common symptoms include fever, swelling of the cheeks and salivary glands, loss of appetite, fatigue, headaches, muscle aches, painful or trouble swallowing, dryness in the mouth, and nausea. Some people, however, do not show any symptoms at all. The mumps is most infectious during the symptomatic stage. Diagnosis. If a doctor suspects that you have the mumps, a blood test or a virus culture may need to be taken. Diagnosis can be pre-symptomatic or post-symptomatic because you can be diagnosed by a blood test or a virus culture, or by examination of your parotid glands, which would be swollen. The diagnosis is not time-sensitive because there is no treatment for the mumps other than symptom treatment. When diagnosing the mumps, doctors should look for swelling in the salivary glands. Treatment. There is relatively no treatment for the disease itself, so treatment is focused on symptom relief, as they can be painful. For self-treatment, most people use anti-inflammatories such as Aleve and Advil, and pain relievers such as Tylenol. You should drink lots of water while you're sick, and you should avoid acidic drinks like juice, because they can irritate the salivary glands. Eating soft foods will help you swallow with less pain. Also, you can apply a warm or cool compress to the swelling area to help reduce the pain. The infection should end in a week or 2. The MMR vaccination is used for prevention. The vaccine is applied to children at 1-year-old and then again at 4 years old. The mumps is not curable, which is why prevention is important. Prevention is easy if you get the vaccine because the MMR vaccine is highly effective. But here are some other ways to prevent the mumps. Do not drink or eat after someone, and wash your hands regularly and thoroughly. You are more likely to contract the virus from less developed foreign countries because they most likely do not vaccinate for the mumps. The effectiveness rate of the treatment is 0% because there is no real treatment for the mumps, and the effectiveness of pain relievers can vary. The MMR vaccine, like all vaccines, has a chance of causing a serious allergic reaction that could cause death, but that chance is very small. There are mild, moderate, and severe problems that could come with getting the MMR vaccine. Some mild problems include a fever, a rash, or swelling of the salivary glands. Some moderate problems include seizures or temporary pain or stiffness in the joints. Some severe problems, which are very rare, include an allergic reaction or deafness/permanent brain damage. The severe complications are so rare that it is difficult to tell whether they are actually from the vaccine or not. Prognosis. The number of deaths from the mumps has significantly reduced since the MMR vaccine was introduced. Most people recover. Complications. Serious complications are very rare. Complications can still occur even if you have been vaccinated, but it makes it even more rare. It also depends on how old you are when you contract the virus. Possible complications of the mumps include encephalitis and permanent deafness. Mumps can be most severe when infected in adulthood, with the possibility of meningitis.